Hello, I'm Nick. In this video I'm going to talk to you about an issue that I consider central and most of you consider central. We are going now in depth to the most important topics, and today's topic is the chronic infections. We are all familiar of Borrelia infection, but the truth is, when we talk about illnesses like ours, chronic Lyme disease, it's not that we are talking about just a bacterial infection. Dr. Richard Horowitz, who is a famous specialist in the United States, and he has many years of experience with chronic Lyme disease patients and people who come to see him with other diagnoses. He's now trying to change the name of our disease from chronic Lyme disease to MCIDS, which stands for multiple chronic infectious disease syndrome, and in that way he's trying to explain that most of us we are not just dealing about we are not dealing with just a Borrelia infection. We do most of us have co-infections like Babesia, Bartonella, Ehrlichia, Anaplasma, Mycoplasma, Chlamydia, and other cell wall deficient bacteria. But we also talk about we also must think about chronic yeast infections like candida, which can be a cause or a consequence from chronic antibiotic therapy or from low immune system, and the same thing happens with parasites. And this is an important topic, and it is underestimated in the Western world. I think more and more in the years that will come, the doctors who are dealing with our illness, they will focus more and more on parasites, because it is conventional medicine, for example, considers that parasite issue is an issue that has to do with the third world, but the truth is that even in civilized countries, most people carry parasitic infections, and it's an important topic because it's the largest creature from all the bugs, and that this creature can produce a lot of toxins, and it can produce leaky gut, and it can suppress our immune system tremendously. And finally, there are viruses, which is the smallest of all the bugs that we can have inside. And in the past, some herpes viruses and others were considered to be the cause of chronic fatigue syndrome, but the truth now is, and most doctors admit that right now, that the problem is the low immune system function from the multiple infections and from the many toxins that we have in our bodies, and the viruses that we all carry they just reactivate and can make the condition worse. So let's first start with parasites. And when we are talking about parasites, we have to remember that the tests for the parasites are unreliable, and Dr. Klinghardt is very clear about that. He states that you should check for parasites within 15 minutes after having a bowel movement, and this is just impossible in most labs. And he states that most Americans and most sufferers with chronic illnesses have parasites in them, and he suggests that the treatment for that must be almost 6 months and more, because worms are very difficult to eradicate. In my point of view, the first thing that you have to focus is your digestion, and I'm talking about the stomach acid right now, and how well your digestion works, and especially your stomach acid, because the human body is designed that way, that stomach acid should be there to kill everything that can come to your body from the food you eat and from your mouth. And if you have any type of hypochloridria or low stomach acid, like me, because I have severe hypochloridria, and I take many supplements with many pills of hydrochloric acid with food, and I have to be very careful. And all of you must try to check for your stomach acid levels, because if you have hypochloridria, then more and more bugs will come into your body, and you are going to have a continuous struggle with more and more parasites and yeasts and all that. Okay, also the pancreatic enzymes are very important, because they help you to absorb nutrients, and they kill the acid resistant bugs that can come to our bodies from our food. Okay, so now parasites, we have two types of parasites. There are two main types. Like the first type is protozoal infections, and the second is worms, which is the largest. And the treatment for parasites, there are many approaches, but in my point of view, I think that we all deserve to have a trial of antiparasitic drugs like albendazole, Allinia, and others, which are drugs that can also cross the blood-brain barrier, which means that they can cross the brain and they can go into your brain. So if some parasites have invaded your brain, they can be effective by eliminating them with these drugs. And the herbs that are used for the parasites most of the times are wormwood, black walnut, and cloves, which is the combination of herb that Hunta Clark suggests in her antiparasitic treatment. But also many other doctors continue to use this combination of three herbs. Garlic is a very important antiparasitic herb, but many people just don't handle it because they have problem with sulfur. And also banderol, cumanda, and other herbs from the Cowden protocol are antiparasitic. And the truth is that I think that we should focus on that, because it's a topic that is underestimated in my point of view. And if you think about it, in the evolutionary. Parasites are the largest bugs in our bodies, and when you treat multiple infections, you have to start with the larger ones and then go slowly to the smallest. So we just have to deal with parasites first. Dr. Klinghardt states that many of his patients feel tremendously better after deworming, after dealing with parasites, and now I'm trying to do that with the herbs that I told you before, and I am also following the Cowden protocol, so I take the herbs from that, and I try to reduce the parasitic the number of parasites in my body. Okay, so let's move on yeast right now. And when you hear yeast, I think that candida comes to your mind, and in mine too. The truth is that candida is the most common form of systemic yeast infection, but there are many other yeasts that can be pathogenic, and they can change form from a yeast form to a fungal form, and this can create a lot of toxins in the body. And the truth is that candida can produce many more toxins than Lyme infection, than parasite infection, and from all the infections that we can have, candida can produce the more toxins. And the truth is that it's very unpleasant to have candida symptoms. I deal with that all the time because of my stomach acid being low. I'm trying to take a lot of hydrochloric acid supplements together with my food, but with low immune function, candida proliferates, and it is very important to have an anti-yeast treatment together with any other antibacterial or anti-toxin or anti-parasitic treatment. I think rotating herbs, antifungal herbs like caprylic acid, like pau d'arco, and sometimes coconut oil, of course, it's a must, and sometimes even taking small courses of nystatin or even diflucan. It can be beneficial. There's a protocol for Lyme disease with just diflucan. This can just show how important it is to fight the fungus that can grow in us when we have multiple infections and many toxins, and the immune system goes down, and the natural killer cells don't work as they should work to fight the infections. For me, candida and yeast infections should be all the time be a consideration when you're trying to detoxify, because toxins and systemic yeast always go together. When you detoxify, the yeast proliferate, because interestingly, having a systemic yeast infection is somehow a protective mechanism from the toxins, because the yeast just stick into the toxins and make and this is a protection for our bodies. Now 15 minutes have passed, so this is the end of the first video about chronic infections. I will do another one talking about the others.